Hello friends, my name is Dr. CHIRAG. I am working as a consultant orthopedic surgeon at Aadicura Superspeciality Hospital. 20th October is a World Osteoporosis Day, and on this occasion, the Aadicura Superspeciality Hospital takes the responsibility to create an awareness regarding osteoporosis in the society. So what is osteoporosis? Osteoporosis is the weakening of the bone. Your bone becomes fragile and it gets fractured easily. So how it happens? In our lifetime, the bone is going through a particular cycle. The calcium gets deposited in the bone and resorbed from the bone. That maintains the calcium level in our blood. But with aging process and with other factors, that balance becomes imbalance. That is, calcium gets more resorbed from your bone rather than deposited. So your bone becomes weak from inside. From outside, you feel that your bones are okay, but from inside, they are weak enough. You can take an example of an old wall. As you can see, as you can feel that to put a keel inside the old wall is become easier with the time. So that what happens with our bone. So how can you diagnose, or what are the symptoms for the osteoporosis? You feel that you had a pain in the back or any of the bone. So it is a common symptom of osteoporosis. You get easily fractured when your bone becomes weak. So with a trivial fall or with a simple injury that cannot cause any fracture in a young healthy individual will cause a fracture. The most common fractures involves your vertebrae or your spine, your hip joint, that is common, and your wrist joint. These three fractures are very common. You can also have seen your parents or your old people that having a curved back or they have lost the height. What happens with that? That in the back, the spine becomes smaller in size because of the osteoporosis. The spine vertebrae becomes weak and they collapse. So that will causes the upper back becomes curved and they lost the height. What are the risk factors for osteoporosis? With aging process, the bones become weak. Hormonal imbalance that happens particularly in females after 45 or 50 years of age, after menopause. Because of hormonal imbalance, the calcium deposition becomes less and less, so that bones becomes weak in female. The dietary imbalance, deficiency of calcium and vitamin D is a common cause for osteoporosis. Lack of exercise also a risk factor for having a weak bones. Certain diseases like thyroid disease, diabetes, any kidney related or a liver related disease can weaken your bones. Certain habits like having a smoking or taking too much alcohol can affect your bone health. So all these risk factors come together and they causes the osteoporosis. How to diagnose? So with simple blood reports like vitamin D level, calcium levels, you can have an idea about osteoporosis. But the most important thing and most important test is a DEXA scan. It's a type of an X-ray which measures the bone density inside the bone. So they have a particular type of gradings from which we can know that you having a osteoporosis. What is the level? That is, it is a mild form, moderate form, or a severe form, and it can guide the treatment of the osteoporosis. How to prevent or treat this osteoporosis? To prevent the osteoporosis, the most important thing is the dietary supplements. Calcium-rich diet like milk and milk products, green leafy vegetables like spinach, flax seeds, almonds, and some nuts. They are the rich source of calcium, so you have to take adequate amount of this in your regular diet. Vitamin D supplements is also important. Sunlight is a natural source of vitamin D, but it requires a proper skin exposure and at least 20 to 30 minutes of daily sun exposure in a midday between 10 to 12. And proper exercise, regular exercise, which involves jogging, walking, swimming, all the weight bearing exercise or some sports also that can help to build your bones stronger. To prevent or to treat for the treatment of osteoporosis, there are a lot of options. The most important ones are the basic ones like calcium supplements and vitamin D. Calcium dosage requirement is around 1000 to 1300 milligrams per day. Vitamin D requirement varies between 600 international unit to 1000 international unit per day, depending on the type of or a risk factor of your osteoporosis. There are certain medications which helps to treat the osteoporosis, like bisphosphonates. Certain injections or hormonal injections like calcitonin, parathyroid hormones. You have to consult your doctor for the proper treatment of osteoporosis, which drugs can help you, and how to prevent it. So this is the basic regarding the osteoporosis. You have to be aware it's a very common disease. In India, at least 20 to 30% of the female aged before more than 50 years are suffering from osteoporosis. We can treat, we can prevent the osteoporosis. So consult your expert doctor or take on help of us. You can take an appointment at Aadicura Hospital and consult our expert orthopedic surgeon. Thank you.